Hello everyone. Today we are going to discuss about the types of dyspnea. But before that, we should know what is dyspnea. So dyspnea is defined as difficulty in breathing. Now this dyspnea can be of different types. Exertional dyspnea is one. जब exert करने पे shortness of breath होगी या difficulty in breathing होगी exertion पे, ठीक है? But this is going to improve with rest. तो ऐसी problem, ऐसी shortness of breath जो rest करने पे ठीक हो जाए और कुछ exertional काम करने पे बढ़ जाए या start हो जाए, उसे हम exertional dyspnea कहते हैं. So if we talk of normal dyspnea, this is classified into 5 grades. Okay? Grade 0, 1, 2, 3 and 4. Based upon the NYHA classification, this stands for New York Heart Association. Grade 0 includes strenuous exercise. कि जब आप कुछ strenuous activity कर रहे हैं, बहुत कोई high exercise कर रहे हैं जिसपे आपको बहुत ही workload पड़ रहा है, उस level पे अगर आपको shortness of breath हो रही है, that is grade 0, right? मतलब this is tough वाला और थोड़ा फिर हम easy activities की तरफ चलेंगे, ठीक है? अब इससे थोड़ा सा grade 1 पे अगर हम आए, it will include hurrying on the level और वॉकिंग अप अ हिल. तो किसी पर्टिकुलर लेवल पे आप ऊपर चढ़ रहे हो या किसी पर्टिकुलर हिल पे ऊपर चढ़ रहे हो, ठीक है, या स्टेयर्स पे ऊपर चढ़ रहे हो, उस टाइम आपको कुछ प्रॉब्लम स्टार्ट हो जाएगी, ठीक है. देन ग्रेड 2 वॉक्स स्लोअर देन पीपल ऑफ सेम एज और स्टॉप्स फॉर टेकिंग ब्रेथ. वेरी वेरी इंपॉर्टेंट एंड दिस हिस्ट्री इज गिवन बाय द पेशेंट्स. वो देखते हैं कि जो मेरे से कम उम्र के हैं, इवन दे आर वॉकिंग फास्टर देन मी, राइट. सो दिस विल बी ग्रेड 2 वॉक्स स्लोअर देन पीपल ऑफ सेम एज और पेशेंट बार बार स्टॉप करेगा सांस लेने के लिए. इन ग्रेड 3 स्टॉप्स फॉर ब्रेथ आफ्टर वॉकिंग 100 मीटर. थोड़ा सा चलने के बाद उसकी सांस फूल जाएगी, थोड़ा सा चलने के बाद, ठीक है. Grade 4 will be breathless while dressing and undressing and breathless to leave the home. So normal daily activities में भी shortness of breath अगर होने लग जाए, so this will be grade 4 dyspnea, right? Other types of dyspnea we're going to discuss now. So next is orthopnea. It is also shortness of breath, but this occurs when lying flat on bed, right? Now the person has to get up of bed, or this patient is going to use lots of pillows to elevate his head. Right? What can be the causes? There may be bilateral paralysis of diaphragm. They can be asthma, but most commonly it can be a late manifestation of heart failure. अब जैसे ही इंसान सोएगा, within 1 to 2 minutes of lying, the shortness of breath is going to start. Why? Because of fluid redistribution into the central circulation, right, and causing an increase in the pulmonary capillary pressure. There is going to be pulmonary congestion. As a result, dyspnea is going to occur. Next, we have trypopnea. This is shortness of breath when lying on one side, right? So if he's having problem on one side, now he's going to lie onto the opposite side and the symptoms are going to get relieved. So obviously there will be causes of unilateral lung disease or maybe even CHF, right? Now what happens here? What is the mechanism? The patient lies on the affected sides. As a result of this, gravitational force causes more blood to go to the lower zone, right? If he is facing this side, so all the blood is going to come towards this side, right? As a result, perfusion is going to increase, but ventilation is going to decrease. So V by Q mismatch, hypoxemia occurs, and this worsens the dyspnea, right? Next is again very very important, that is PND, paroxysmal nocturnal dyspnea. Now in this type, shortness of breath, it occurs at night, that's why the term nocturnal is there, and makes the patient wake up from sleep. Again very important, the patient is sleeping, he is getting up from his sleep. So obviously usually occurs after 1 to 2 hours after sleep. In orthopnea it was 1 to 2 minutes. अभी वो सोया भी नहीं था, लेटते ही स्टार्ट हो गई. इसमें वो सो गया था, नींद से उसे उठना पड़ा, right? So 1 to 2 hours after sleep. Shorter duration of dyspnea, 10 to 30 minutes, right? It can occur in left-sided failure. Same, venous return to the heart and lung increases, pulmonary congestion and dyspnea. Then there is something which is known as platapnea. Shortness of breath occurs when in upright position, right? Upright means whether he's standing or sitting. Obviously, अब खड़े होके हो रही है, so the patient is going to get relieved in supine position. Now what happens in this? The gravitational force causes more blood to go to the lower zone of lung. As a result, the same in perfusion is going to increase, ventilation is going to decrease, VQ mismatch and dyspnea. Another is bendopnea. It occurs within 30 seconds of bending over waist. Maybe he's tying shoes or picking up something, right? So in cases, and this is sign of worsening of heart failure.